Can you overdose on semaglutide? That's a really important question, and the honest answer is yes, taking too much can cause serious complications, even though it's not quite the same as a traditional drug overdose. As semaglutide becomes more widely prescribed, more people are using it, and that means more chances for dosing errors. Understanding what can go wrong and what to do if it does is genuinely important for anyone on this medication. So let's get into it. Semaglutide is a GLP-1 receptor agonist. You might know it by brand names like Ozempic, Wegovy, or Rybelsus. It's FDA approved for type 2 diabetes and chronic weight management. It works by mimicking a hormone called GLP-1, helping regulate insulin, slowing digestion, and reducing appetite. Now, here's something that might surprise you. There is no established lethal dose of semaglutide in humans, but, and this is a big but, that does not mean you can take more than prescribed without consequences. Exceeding your recommended dose can absolutely cause serious harm. The most common signs of too much semaglutide are gastrointestinal, severe nausea, persistent vomiting, and diarrhea. On their own, those sound unpleasant but manageable. The problem is what they can lead to. Significant vomiting and diarrhea cause dehydration. Dehydration throws off your electrolyte balance, and that combination can put real stress on your kidneys, potentially leading to acute kidney injury. And there's also a risk of hypoglycemia, especially if you're taking other diabetes medications alongside semaglutide. One thing that makes semaglutide overdose particularly tricky is how long it stays in your body. Semaglutide has a half-life of about a week, which means it can remain active in your system for several weeks. So if you take too much, symptoms don't just pass in a few hours, they can persist for days, sometimes longer. And right now, there is no specific antidote. Treatment is entirely supportive, meaning doctors focus on keeping you hydrated, correcting electrolyte imbalances, and watching closely for complications. So how do dosing errors actually happen? A few common ways: some people confuse their dosing schedule and accidentally take doses too frequently. Others have trouble with the pen device and aren't sure whether a dose was actually delivered, and then take another. And compounded versions of semaglutide, which aren't FDA approved, can come in different concentrations that make accurate dosing much harder to get right. All of these are preventable with the right education and support. Here's what to talk to your healthcare provider about. Make sure you fully understand your prescribed dosing schedule and be aware that the formulation matters. The injectable versions, Ozempic and Wegovy, are taken once weekly, while the oral tablet, Rybelsus, is taken daily. Always follow the specific plan your prescriber gave you. Ask your doctor or pharmacist to walk you through how to use your device correctly. If you're ever unsure whether a dose went through, don't take another one. Contact your healthcare professional first, and if you're using a compounded product, ask your prescriber or pharmacist for written product-specific instructions. Do not attempt to calculate or convert doses yourself. Now, when should you seek help immediately? If you've taken more than your prescribed dose, contact your healthcare provider or poison control right away, even if you feel okay in the moment. In the US, you can reach poison control at 1-800-222-122 or visit poisonhelp.org. Don't wait to see how you feel. Go to the emergency room or call 911 if you experience persistent vomiting that won't stop, signs of severe dehydration, symptoms of low blood sugar, or anything that feels serious or is getting worse quickly. Quick recap. 1. There's no known lethal dose of semaglutide in humans, but taking too much can still cause serious complications. 2. Semaglutide has a long half-life, so overdose symptoms can last days to weeks, and there's no antidote. Treatment is supportive. 3. Most dosing errors are preventable. Know your schedule, use your device correctly, and always check with your doctor before taking an extra dose. Nothing in this video is a substitute for personal medical advice. Talk to your healthcare professional about your specific situation and any concerns you have. If you found this helpful, drop a comment below and subscribe so you don't miss what's coming up.